Hi, I'm Jane Morton. I work for the Western Montana Area 6 Agency on Aging in Polson. We serve Lake, Lincoln, Mineral, and Sanders counties here in Western Montana. And this is part 2 of our 3-part Welcome to Medicare series to help you sort out all the parts of Medicare. So I'm going to scoot out and let you look at the slides here. I'm a SHIP counselor for the Western Montana Area 6 Agency on Aging. The Montana State Health Insurance Assistance Program, or SHIP, trains people to help you with all the ins and outs of starting Medicare, and also with any problems you have with Medicare once you get started. We have 4 SHIP counselors here in our Polson office, and we also have SHIP counselors who live in Lincoln, Mineral, and Sanders counties. And if you call us at 551-3191, we can tell you how to get in touch with them if you need to. In part 1, I talked mostly about Part A and Part B of Original Medicare. If you have Part A and Part B of Original Medicare, you still don't have drug coverage. So you need to add a Part D prescription drug coverage. Original Medicare didn't have any drug coverage, and in, I think it was 2006, Congress acted to add Part D to Medicare to allow Medicare to provide drug coverage. So in this section of our Welcome to Medicare series, we're going to talk mostly about prescription drug coverage, and then we're also going to talk about Medigap policies. Okay, Part D is prescription drug coverage. Part D is offered by private insurance companies that are under contract with Medicare. You can get Part D Medicare through prescription drug plans to go with Original Medicare. You can also get prescription coverage as part of a Medicare Advantage plans. And in section 3 of this series, we talk more about Medicare Advantage plans. Right now, I'm mostly going to talk about prescription drug plans. When do you start a Part D plan? Well, the initial enrollment period is the same as for Parts A and B. It's the 3 months before your 65th birthday month, and the 3 months following your 65th birthday month. Now, if you choose to stay on employer insurance because you're still working and you want to delay Part B, then you don't need to worry about a Part D because your employer insurance will cover your prescriptions also. However, if you're stopping your employer insurance because you're leaving that job, you have 63 days after it ends to get a Part D drug coverage without a late penalty. This is just a graphic to show that initial enrollment period. That's the same as for Parts A and B. And if you sign up for a Part D plan during the 3 months prior to the month you turn 65, there's no delay in the start of your Part D coverage. It starts on the first of the month when you turn 65. If you wait till the month you're 65 or the months after, there is a delayed start on your Part D coverage. How do you go about starting Part D? Well, the best way is to use the Plan Finder tool on Medicare.gov. If you Google Medicare.gov, lots of sites are going to come up, so make sure you're on the one that says it's the official site. Then when you get on the Plan Finder tool, you put in your prescriptions and you find out which is the most economical plan for you according to the prescriptions that you take. If you once you decide what plan you want, you can enroll on that same site. If you come to us, get an appointment with the ship counselor, we help people do this all the time. The Plan Finder tool is what we use to compare plans, help people find the best one, and sign them up. Once you have chosen a plan, you can also call the company and enroll over the phone if you prefer. It's not what we recommend because it's a lot more painful. I've had to help people do that too for one reason or another. And it's way better to go to Medicare.gov and use the Plan Finder tool. If you're not able to afford prescription drug insurance, there are programs to help you with that. One is through the Social Security Administration. It's called the Extra Help program. It gives you help paying for the premium, and it also lowers your co-pays even more when you go to pick up your prescriptions. The Extra Help program has income limits and resource limits. As you can see here, the income limit for a single person is $18,975 a year. And that single person must have resources less than $14,390. That includes money in the bank, property other than the home where you live, recreational vehicles, that sort of thing. The couple income limit is $25,605 and the resource limit is $28,720. There's another plan that can help you with your Part D costs. If you don't qualify for Extra Help, you might qualify for Big Sky RX. This is just for people who are Montana citizens, and it helps pay for your premium up to a maximum of $34.40 in 2020. And that covers in full most prescription drug plan premiums. It does not lower your co-pays any more than the insurance already lowers it. The Big Sky RX program does have income limits. They're a little more generous than the income limits for Extra Help. A single person can make up to $24,980 and still qualify for Big Sky RX. A couple can make up to $3,000 and $3,820. There is no asset limit on Big Sky RX. They do not consider your asset limit. So this is really nice for a lot of Montanans because Montana is a low-income state, so it's not unusual for Montanans to have income less than what's shown here, but perhaps have, you know, a nest egg they've scrimped and saved to build up in the bank, or a family ranch and some farming equipment that would put them over asset limits for another program. So no asset limit on Big Sky RX. Besides the help paying for your prescription drug plan or the Medicare savings program that I mentioned in section 1 that helps you pay for Part B, there are other safety net programs out there for the older population, including help with energy costs, help with housing costs, help with taxes. The Benefits Checkup program is run by the National Council on Aging, and there's a special program set up just with Montana's programs by Montana Department of Health and Human Services, and we can run a benefits checkup on you, and it will spit out a list of what programs are available in Montana that you may qualify for. We don't put any identifying information into that. It just gives you an idea of what programs you may qualify for. Then if you want to apply for that program, we can help you with that application. On prescription coverage, there are some common mistakes that people make, and I'd like to talk about the one at the bottom first because it's the one I run into the most. A lot of people, when they turn 65, are still pretty healthy. They don't have many prescriptions or maybe none, and a lot of those people say, well, I don't take any prescriptions. Why do I need prescription drug coverage? I'll just get it later. And you don't ever have to get prescription drug coverage. But from the time you become eligible for prescription drug coverage, if you go without any prescription drug coverage, a late enrollment penalty starts to build up. And you don't want that late enrollment penalty. And we'll talk some more about that late enrollment penalty a little bit later. Going on up from the bottom, choosing a plan based on name recognition, like you saw an ad on TV, or choosing the same plan your spouse or your neighbor has because they're happy with it, isn't wise because they don't have the same prescriptions that you do. And they may not need the same plan that you need. They may need a more expensive plan and you don't need as expensive a plan. Using the plan finder on Medicare.gov is definitely a better idea than either of these ways of choosing a plan. And then the last one, or the top one, staying with the same plan every year. A lot of people get a prescription plan and they're happy with it and it works really well, and so they decide, oh, I'll just stay with that and I'll just let it roll over to next year, and that way I don't have to do anything, and I'm happy with it, so it should be fine. That's always not a good idea. For instance, just this past year, in 2019, we had a plan that discontinued their cheapest plan, and in the law, they're allowed to just roll you over to a different plan if your plan is being discontinued. However, they rolled people over to their most expensive plan, so people's prescription drug costs went up by like $50 a month, even if they didn't need such an expensive plan. All the insurance companies are allowed to change the name of the plan, change the price of the plan, change what drugs they cover every year, so we really recommend that every year you go on that plan finder and check to see if the plan you're on is the best deal for you next year or if you need a different plan for next year. The open enrollment period is between October 15th and December 7th every year, and that's when you get a chance to compare next year's plans and see if you want to stay with what you have or change to something different. You can change prescription drug plans. You can also change Medicare Advantage plans during open enrollment. We'll talk more about Medicare Advantage plans in the next section, but just be aware that you can change both prescription drug plans or Medicare Advantage plans during open enrollment. And we've listed 3 ways to compare your plans here. First one is use the plan finder at Medicare.gov. Starting October 15th every year, they have the information on that computer program for the next year so that you can look at it. The third one is call a ship counselor. We'll help you. We use the Medicare plan finder, so you can do it yourself or you can call us and we'll help you do it. The second one, calling 1-800-MEDICARE, is an option. It's not a good option. If you've ever called 1-800-MEDICARE, it's like calling 1-800-SOCIAL SECURITY. Not a good idea. You'd be on hold so long, you're tearing your hair out already, and then the help they give you is cumbersome at best. So the best ways are to either go on Plan Finder yourself or get an appointment with a ship counselor so they can help you go on Plan Finder. Okay, I said we'd talk some more about the late penalties. Let's go from the top down here. We talked about Part A and B in a different section, and we talked about these late penalties, but I just want to go back and mention them again a little bit. Most people don't have to worry about any kind of late penalty for Part A because they qualify for premium-free Part A. Either they or their spouse has at least 10 years where they paid payroll taxes. The only people that might have to have a late enrollment penalty for Part A are the people that don't qualify for premium free. Neither they nor their spouse has 10 years where they paid payroll taxes, but they choose to pay to get Part A Medicare, in which case if they are late, they may have this 10% penalty. Well, as I said, most people don't have to worry about this Part A late penalty. Part B late penalty, everybody has to pay that monthly premium for Part B. If you go for 12 full months without Part B, when you could have had it and you weren't covered by other insurance, then you have a 10% monthly premium increase. And that is a penalty for life. In other words, you'll pay 10% extra every month for the rest of your life. If you go 2 full years without any coverage, then you'll pay 20% extra for the rest of your life, every month. And so on. If you go 10 years and then you want to get Part B, you'll pay double because you'll pay 100% extra. Part B, also that late premium, now it may not sound like very much at first, it's 1% of the national median plan price. 1% of the national median plan price is around 34-35 cents, but it's 34-35 cents for every month not enrolled in a Part D plan. So if you go several months, you know, you might have a few dollars penalty, but you would have to pay that few dollars extra every month for the rest of the time that you have Part B, which is usually the rest of your life. If you went 10 years, you might have $20-$30 a month extra you have to pay on top of your premium. And we can't make that penalty go away. A lot of people don't take care of these things in a timely manner, and then when they get slapped with a penalty, they come to us to try and straighten it out. And there isn't really anything we can do to make those penalties go away. If you're very low income and you qualify for certain programs, you might get the penalty to go away, but most people have it for life. Okay, the other thing we're going to talk about in this session is Medigap. I want to just go back for a minute to here. We're still talking about original Medicare. You get Part A and Part B, then you get a drug plan, and then if you want, there's private insurance that you can get to supplement your original Medicare. When we talked about Part A and Part B, I talked about different, not just monthly premiums, but deductibles and co-pays that you're responsible for under Medicare. If you want, you can get additional supplemental insurance. It's private insurance, but it supplements your original Medicare. So now let's go back to where we were. Okay, Medigap plans help with your out-of-pocket costs, like deductibles and co-pays. There are different plans that you can choose from. They have different prices depending on what they cover. And the plans are standardized, which means a plan, if you choose a plan A, for example, from the Smith Company, their Plan A has to cover exactly what Plan A from the Jones Company covers. An A is an A from either company, but they don't have to charge the same price. That's their marketing decision. This chart shows the different Medigap or supplement plans that you can choose from. Now, I don't want you to confuse this with Part A Medicare and Part B Medicare. These are different plans, Medigap plans. Plan A, Plan B, Plan K. From here on up, all of them cover the things I'm going to mention. If there's a check mark, it means they cover 100% of your share of the cost. If there's a percentage, obviously they cover that percent of your share of the cost. If there's a blank, that means they don't cover that item. Okay, let's talk about these items. Part A coinsurance is if you're in the hospital more than 60 days, you begin to have a copay. All Medigap plans will cover that copay. Part B coinsurance, under Part B, you pay 20% and Medicare pays 80%. All Medigap plans cover that 20% of yours. Blood, under both A and B, you're responsible for buying the first 3 pints of blood. All Medigap plans cover that. Part A, hospice care. Hospice is covered almost 100% anyway, but any small coinsurances or copays are covered by any Medigap plan. Then, once you get to this, you can see not all the plans cover them. Skilled nursing facility care coinsurance. This is if you're in the hospital for a minimum of 3 days and the doctor says you've got to have some rehab, Part A Medicare will pay for up to 20 days of rehab. If you're there longer than 20 days, you have a copay from day 21 to day 100. You can see that Plan A and Plan B don't help you with that. But these other plans do cover that skilled nursing care if you have to be there longer than 20 days and have a copay. Part A deductible, if you're hospitalized, Part A covers that, but you're responsible for a deductible. In 2020, it's about $1,400. You can see Part A does not or Plan A does not cover that, but all the other plans do cover that Part A deductible. Part B also has a deductible. It's an annual deductible of only $198 that you have to pay before Medicare Part B starts to pay. None of the plans cover that, but it is a pretty small amount. Part B excess charges. If you go to a doctor that does not accept Medicare assignment, they're allowed by law to charge 15% higher, which all comes out of your pocket. Plan G covers excess charges, and the others do. The last item here, foreign travel emergency. Medicare doesn't pay outside the United States, but some of the plans will cover foreign travel emergency. The out-of-pocket yearly limit only applies to the plans that pay only a portion of your share. If you have spent this out-of-pocket limit, then they cover 100% after that. The premiums for Medigap plans vary based on your age and the amount of coverage that you choose. Some of them tie their premium cost to the age you were when you initially purchased it, the issue age. So if you purchase an issue age plan at age 65, your premium cost is always tied to age 65. Some plans, probably more of the plans, increase the premium level as you age. Every year that you age, your premium's going to go up a little. So your premium cost is always tied to your attained age, and that's why that's called an attained age plan. The deductibles and copay amounts also depend on the plan that's purchased. This sheet tells what costs you may have for under Part A and Part B. So you might like to have a copy of that. And then remember I said that Medigap plans are private insurance. So the Medigap industry is controlled by the state insurance auditor's office, and they have two booklets, or we have two booklets that we printed off of their website. One is just a consumer guide that kind of explains more about how Medigap works. One is a supplement rate comparison guide, and it's updated every year so you can compare the prices of different companies. As I said, the plans are standardized, so if you decide, oh, I want a plan G, you know that you're shopping for exactly the same thing from every company, even though they may price it different. So you're comparing apples to apples. There are some consumer protections in the Medigap industry, and one is, or the biggest one is that when you start your Part B, from the day your Part B starts, there's a 6-month guaranteed issuance period where if you want to buy it, they have to sell it to you, no questions asked, no health questions. Doesn't matter if you have cancer, if you have all kinds of heart problems, they can't deny you. They can't do underwriting for pre-existing conditions. During that 6 months, you have guaranteed issuance. Now, if it's one day after that 6 months is over, they will ask health questions. They can turn you down. They don't have to sell you a Medigap plan. But if you buy one during that guaranteed issuance, you can keep it as long as you want. As long as you keep paying for it, they have to keep paying your bills. Again, they're regulated by the Montana Commissioner of Insurance, which is part of the state auditor's office. And those two booklets I showed you came from their website, which is csimt.gov. And if you're comfortable on the computer, you can just go look at the information there, but we can also mail you a booklet out. Sometimes it's important of which insurance company or which insurance has to pay first. Medicare is primary to supplemental or Medigap or retirement health insurance, and also Indian Health Service and Medicaid. In other words, Medicare has to pay first, and then these other insurances come in after that. However, if you are on employer-sponsored insurance because you're still working, in most cases it's primary and Medicare is secondary. They have a foot-long list of rules, but usually Medicare is secondary. And that's the end of Section 2 of Welcome to Medicare. Again, we are Western Montana Area 6 Agency on Aging. We serve Lake Lincoln, Mineral, and Sanders counties and the Flathead Reservation. We are at 110 Main Suite 5, Polson, Montana, 59860. You can call us, the local number is 406-883-7284, or the toll-free number is 1-800-555-3191.